Hello everyone, this is Group 2 of Class B and we are going to present our student project about long bone trauma. Next. These are the members of our group. Next. Chapter 1. Next. Alright, my name is Joanna Fortainira with the last 3 digits of student number 039 and I will explain about the background. Urbanization and globalization in Indonesia have rapidly increased and become one of the factors to the advancement of the country. In addition to the advancement, there are also negative impacts, such as massive traffic congestion, where traffic accidents could happen. Musculoskeletal trauma has become a serious problem in developing countries, as the cases itself keep increasing in Indonesia. These traumas related to the bones can happen in settings such as traffic accident, sports-related injuries, work-related trauma, etc. Long bone fractures are one of the injuries caused by trauma. According to the Riskesdas 2018, cases of fractures of the lower extremities due to the accidents have the highest prevalence. Around 67.9% of cases are fractures in the lower extremities, where fractures of the femur have the highest cases. Next. Long bone trauma has large impacts on a patient's life. The injuries resulting from the trauma affect many facets of life, including physical, psychological, and social life of the patients. So based on the fact that the musculoskeletal trauma cases increase each passing day in Indonesia, the knowledge of long bone trauma is important to prevent mortality and morbidity. The next one will be explained by my friend.
My name is Jennifer Jasna Gunawan with student number 068. Listed below are the formulations of the problem. The purpose of this paper is the importance to understand the definition, epidemiology, etiology, risk factors, pathophysiology, healing process, sign and symptoms, diagnosis, differential diagnosis, treatments, complications, and prognosis of long bone trauma. And the benefit are clinicians can increase understanding and provide better care for patients with long bone trauma, and the society will benefit from more information regarding long bone trauma, hence increasing awareness.
Hello, doctor and friends. My name is Duna Wisdaus, number 165. I will continue with the definition of long bone trauma. Long bone trauma defined as an injury to the long bone caused by mostly physical factor which may result in bone defect. It causes an imperfection, failure, or absence of something in the bone that changes the anatomical structure, physiology, and function. High energy trauma and low energy trauma are two mechanisms of long bone trauma. High energy trauma is an injury caused by force with high amount of kinetic energy, while low energy trauma occurs spontaneously or with minimal force. The most common lesions that occurs in long bone trauma is a fracture. Fracture is a discontinuity of the bone because of force that result in transverse compression and spiral fracture. Two main categories of fracture are open and closed fracture. The presence of a wound that exposes the fracture hematome to have contact with external environment, which accompanied with overlying soft tissue damage, distinguish an open fracture from a closed fracture. Thank you.
My name is Yusuf Alim, student number 149, and I'll explain about the epidemiology. The prevalence is as high as 57% of the injury burden, often occurring in low-income countries, which includes accidental injuries, non-occurring injuries, and violence injuries. The distribution is dominated by motor vehicle accident, with long bones being the largest contributor to fracture slots at emergency center referrals. Fractures of the long bones that often occur are in the femur humerus, tibia, with a prevalence of 3%, 14% and 34% respectively. Next, in children, the most common occurrence were transverse fractures, with the most dominant location of the femur with the number of fractures, the 5 until 5 years age category occupying first position, and figure 2.1 shows graph of fracture occurrence percentage in children. Left side is fracture location and the most common fracture types, and right is the type of fracture in for each categories. Thank you.
Hello, Doctor and friends. My name is Amanda Fiani Maria Sitapu with student number 111, and here I will continue about the etiology and risk factors. So excessive pressure or direct trauma to the bone causes a crack that causes damage to muscles and tissues. Muscle and tissue damage will cause bleeding, edema, and hematome. The fracture site may only be a fracture in the bone without moving any bone. Fractures that do not occur along bone is considered as incomplete fracture, whereas fracture which occurs in all broken bones is known as a complete fractures. As risk factors, Age and gender are the largest causes of fracture. Women are much more likely to have fractures than men. This is because the bones of women aged 25 to 30 generally smaller and less dense than the bones of men. And several other risk factors are smoking, drinking alcohol, steroids or corticosteroids, rheumatoid arthritis, other chronic disorders such as celiac disease, Crohn's disease, and ulcerative colitis. And the last is type 1 diabetes patients who have low bone density.
My name is Nekade Sarasdwiguna with student number 25. So based on the pathophysiology, fracture can caused by injury, repetitive stress, or abnormal or pathological weakening of the bone. And fractures due to stress and further pathological condition are known as a traumatic fracture, while the fractures due to injury are called traumatic fracture. The stress fractures occur due to repeated application of heavy loads to the bones, and usually occurring in athletes, dancers, or military personnel. In stress fracture, the exposure duration and the frequency of stress occur faster than the remodeling process, so there is not enough time to repair the microfracture. And the pathological fractures that is occur because of occlusion that have bone microstructure, and remodeling pathway. Bone conditions are attenuated due to structural changes as in osteoporosis, osteogenesis imperfecta, or prejudice, or due to litigation as in bone cysts or metastasis. But the most fractures are caused by trauma. Fracture occur due to the sudden excess of force, either directly or indirectly. Direct pressure causing fracture and soft tissue damage at the point of the impact, and usually will form a transfer fracture or bend to form a butterfly fragment. And then for the indirect fracture occurs when the fractures occurs not at the point of the application of the force, so the fracture will be certain distance from where the force is applied. The fracture patterns are formed from a combination of force such as twisting, bending, compression, or stress. In long bones, the fracture is affected by the applied force. Twisting will form a spiral fracture, compression will cause a short oblique fracture, bending will result in a triangular fracture with a butterfly fragment, and tension will form a transverse fracture.
Hello, my name is Dava Satria, student number 146. I'll explain about fracture healing. Fractures are a breach in the continuity of the bone cortex structure, which can affect the surrounding soft tissues. After the fracture, the secondary healing starts consisting of 4 stages, which are hematoma formation, fibrocartilaginous callus formation, bony callus formation, and bone remodeling. Hematoma formation begins directly after a fracture, where the blood vessels that supplies the periosteum and the bone are ruptured. These ruptured blood vessels will cause the formation of hematoma around the site of the fracture. Temporary frame for healing is formed by the clots of the hematoma. Fibrocartilaginous callus formation is marked by the release of VEGF at the site, which will start angiogenesis. This event will cause granulation of tissue rich in fibrin to begin developing. Formation of the bony callus undergoes the ossification of endochondrule. This will express rank L, which will then start to further differentiate the osteoclasts, osteoblasts, chondroblasts, and chondroclasts. Remodeling of the bone is the continuation of migrating osteoclasts and osteoblasts, making the hard callus to repeatedly undergo remodeling, or as called coupled remodeling.
Hello, my name is Muthu Binama Saranarika, with student number 239. I will explain about signs and symptoms of long bone trauma. Open injuries of the tibial long bone occur with a spectrum of injury severity. Injuries soon become clear that a classification system was needed to quantify the extent of soft tissue injury and to direct the treatment. The Gusilo-Anderson classification has been the guideline for the classification of open fractures. Gusilo grouped them into 3 broad categories, namely type 1 to type 3, based on the degree of soft tissue injury and the appropriate size of skin wound. Type 1 fractures were defined as clean wound with a skin wound less than 1 cm and simple fracture pattern. In type 2, fractures have skin lesion more 1 cm with minimal soft tissue injury and no flap or avulsion. In type 3 was originally more broadly defined as a broad injury consisting of multi-fragment fractures, extensive soft tissue damage involving vascular injury or traumatic amputation. For close fractures, according to Ors and Tern classification as grade 0 to grade 3. For grade 0 is an indirect force injury with minimal soft tissue damage. Grade 1 is superficial contraction or abrasion and simple fractures. Grade 2 is deep abrasion, muscle skin contraction, direct trauma, and impending compartment syndrome. For grade 3 is excessive skin contraction, crushed skin or muscle damage, subcutaneous degloving, acute compartment syndrome, and rupture of major blood vessel or nerve. With result, thank you.
Okay, my name is Abhidhan Nakal from Bodo with 3-digit student number 124, and I want to explain about the diagnosis and differential diagnosis of the long bone trauma. The diagnosis of long bone trauma can be done through history taking, physical examination, laboratory, and also imaging. The result of history taking are pain, soft tissue swelling, ecchymosis, expanding hematoma, altered sensation, impaired motor function, ponegrammitis, and callus. The physical examination can be done such as inspection, palpation, and trauma examination. We can also do imaging and laboratory exams such as X-ray, CT scan, MRI, CPC, blood typing, and cross-matching to assist establishing the diagnosis. The differential diagnosis of long bone trauma can be seen from the location of the trauma and also the type of the fracture or trauma at trauma site.
My name is Kamang Aridata Grasidi, student number 234. I want to explain about the medication treatment. So the first is NSAID, so non-steroidal anti-inflammatory, play an important role in association with analgesic efficacy and anti-inflammatory effect. NSAID is the most commonly used drug in patients with pain and reduce inflammation due to disease or injury. The second is vitamin D and calcium. So the role of vitamin D and calcium are crucial for maintaining bone health, which lack of calcium and vitamin D negatively influence fracture healing. Calcium and vitamin D supplementation that begins after a fracture and continues throughout the healing process prevents the post-traumatic bone loss. Additionally, several experimental studies have reported improved bone regeneration with calcium and vitamin D supplementation, and this data indicate the high clinical potential of calcium and vitamin D supplementation in post-traumatic bone remodeling outcomes and fracture healing. The last is vitamin C. So recent studies have shown that vitamin C may accelerate bone healing after fracture, which can increase collagen type 1 synthesis and decrease oxidative stress parameters.
Hello, my name is Bagus Nagasya with 3-digit student number 032. Long bone fractures such as breaks in the thigh bone or femur need to repair damaged tissue with surgery. Pins or plates may be also used by surgeons to provide extra support so bones safely held in place as they recover. Orthopedic surgeons who are skilled in minimally invasive and open techniques always choose the least invasive treatment. Surgery options include the first one is internal fixation. Surgeons move bones in the correct position carefully and often use metal tools such as pins, nails, or plate to keep crushed long bones fragments together when they heal. The second one is external fixation. Surgeons stabilize severely fractured bones to pins or metal rods outside the body. External frame connects to metal pieces attached to broken bones and provide extra support so it stays in place. And the third one is bone grafting. Surgeons may reconstruct a fractured bone when some of the parts have been crushed or broken beyond repair. They reconstruct the fractured bone using a healthy bone tissue from another part of the body or other donor. Thank you.
Operating on a medical case has its risk on the patient itself having complications. Few of the complications of long bone trauma are osteomyelitis, fat embolism syndrome, and hemorrhagic shock. Osteomyelitis is a condition where the bone infected through contagious spread from joints and tissues around, immediate bone inoculation from surgery or trauma, and the hematogenous route of the infection via bacteremic seeding of the bone from a vast source of infection. FES are believed to have two theories on how it occurs from long bone trauma, which are mechanical theory and biomechanical theory. The mechanical theory that fat cells containing in the bone marrow gains access into the venous sinusoids after trauma. Those fat cells have prothrombic and pro-inflammatory attributes, which can trigger fibrin generation, acceleration, and rapid platelet aggregation as it travels the system of venous, which consequently cause lodges in the pulmonary arterial circulation, leading to edema and interstitial hemorrhage, reactive hypoxemic vasoconstriction, and alveolar collapse. The biochemical theory states that FES clinical manifestation can end in a pro-inflammatory state. Bone marrow fats are broken down by tissue lipases, causing alarming levels of toxic free fatty acids and glycerol. The products created can lead into dysfunction of end organ. Toxic injury of pulmonary endothelial cells and pneumocytes in the lungs possibly causes toxic edema, pathogenic edema, and hemorrhage leading to hemorrhage shock.
Hello, my name is Madeline and my last digit number is 093, and now I will discuss about the prognosis of long bone trauma. If the initial management is good, which is a clinical pathway for managing the pain, the patient will feel more comfortable and less anxious. Meanwhile, when there is no appropriate treatment at the right time after getting a fracture, there are some possible implications such as malunion, fat embolism syndrome, avascular necrosis, and prolonged immobility. And the outcome of the fractures with damage extension to the nerve, soft tissue, and vascular may cause a complex regional pain syndrome. Thank you.
Hello, my name is Anggara with lesson number 194. In conclusion, in many nations, long bone trauma dominated by fractures is prominent, with traumatic injuries being the most common cause. Fracture itself, a condition where there is a discontinuation of the bone. Treatment can be divided into medical treatment and surgery. Osteomyelitis, fat embolism syndrome, and hemorrhagic shock are all possible complications. Different injured location might have a consequence on a patient's everyday life.